I'm Gavin Winston. I'm a neurologist and clinician scientist here at Queen's University in the Department of Medicine and the Centre for Neuroscience Studies. So my clinical practice and research lab are based around people with epilepsy. So epilepsy is one of the most common and serious neurological disorders and affects around 130,000 people here in Ontario. Unfortunately, despite the many medications we have available, we are unable to stop seizures in around a third of our patients. And this has a lot of adverse consequences, such as not being able to drive, unemployment, injuries, and so on. Kingston Health Sciences Centre was designated a district epilepsy back in 2018. And alongside my colleagues, Dr. Lomax and Dr. Shukla, we're offering an increasing number of treatment options to our patients in the region. This includes, for example, the possibility of offering brain surgery performed by our neurosurgeon, Dr. Levy, to help cure seizures. However, to perform surgery, we need to know which part of the brain the seizures are arising from. And unfortunately, this can be particularly tricky. So often, for example, the MRI brain scans we perform come back as looking completely normal. In recent years, we've been introducing some new techniques for MRI scans to try and help identify where the seizures might be arising from, because we need to know where we can operate on and also whether it is safe to perform that surgery. So in this project, we're going to be introducing a number of new brain scanning techniques and analysis approaches with this SEAMO Innovation Grant to help us try and improve our localization of where the seizures are arising from. These results will then be used in our epilepsy surgery meetings with our multidisciplinary team to try and help increase the number of patients who are being offered the curative surgery. The type of patients that are involved in this research are those who have frequent disabling seizures, despite having tried a number of different medications. We know that sadly other anti-seizure medications will not be effective in this type of person, but surgery could be a completely transformative option as it can offer a cure to the appropriately selected patients. So if we're able to stop someone's seizures, this can have a massive beneficial effect on their quality of life. So people can, for example, return to employment or return to driving and so on. So the project that's been funded is very translational because we're aiming to improve the quality of care to our patients. And the advances we make here, we are going to share with other centres across Canada and internationally, so they can hopefully benefit too from our research. So SEAMO is quite unique in the arrangement it has because it offers the physicians in our region of Southeast Ontario to offer clinical service, research, and education alongside each other. So this funding that I've received is one example of the sort of support we can get as researchers, and I'm hoping this can benefit the patients in our community and also further afield. I'd like to really end by saying that this type of research support is vital to support the ongoing growth of our epilepsy program here in Kingston, as other funding sources that are available often do not cover this type of research. So we're hoping this can be a key component of supporting our program here in Kingston and our aims to become a regional epilepsy surgery centre in the future. This would enable us to then obtain further provincial funding for our epilepsy services here, which we can then offer improved quality of care to our local population.